your patience until after both Mr. Calicott and our physicians have spoken. So I will turn it over right now to David Calicott. He's the president of Lafayette General Health.
Thank you, Daryl. On behalf of the entire Lafayette General Health family, I want to express my condolences, and they go out to all of the families, all of the folks in this very close-knit community that have been affected by the horrific events of yesterday evening. We're a very close-knit family here at Lafayette General, and we certainly had many ties to the victims as well. Macy Bro, one of the victims, is an X-ray student. She was scheduled to begin radiology school here at Lafayette General just in a few days, and just 2 weeks ago toured the facility and met many of our staff. And so this really hurts for our staff. Jillian Johnson, also very well known to our staff and our community, a very successful business owner, Red Arrow Workshop, also a very talented musician that really touched many folks here in our community with her unbelievable talents. We are deeply saddened by the events that have transpired, but we're also very thankful for the unbelievable job that our local emergency response personnel, Acadian Ambulance, performed, and also the tremendous job that our local police departments did in responding to this horrific incident. I also want to take time to thank the many hospitals, health systems throughout the country that have reached out to us over the past few hours, expressing their concern, also asking if there's anything that they can do to help in this situation. And so the hospital community throughout the country, I certainly want to thank each and every one of you. Lafayette General received a total of 5 patients. 3 of those patients arrived via EMS. And 2 of the patients were actually brought by private vehicles. All 5 of the patients were sustained gunshot wounds. 3 of those patients arrived and were under level 1 trauma status at our facility, and another was classified as a level 2 trauma. Now, as Daryl mentioned, we are in the process of becoming a level 2 trauma center at our facility, and all the protocols that we've put in place in preparation for that certification were absolutely put in place last evening. Our staff responded very appropriately. Our medical community, our physicians responded in an unbelievable way. We had certainly the situation well planned for, and it really goes to the wonderful work that our trauma team has been putting together over the past 12 months. A level 1 code trauma that I mentioned is called when a patient sustains a gunshot wound to the head, neck, or torso, or the extremities proximal to the knee or the elbow. 2 of the patients were treated and released last evening, while 3 patients were admitted to the hospital. One of the patients here that were admitted here required surgery, and another required admittance to our intensive care unit. The 3 patients that we have here at Lafayette General are all now in stable condition. I want to now introduce to you Dr. Foster Cordish, who serves as our ER trauma coordinator at the facility. He was one of our attending physicians in the emergency room last evening. Thank you. Foster.
Thank you. I'm Dr. Cordish. I'd just like to take this opportunity just real quick to give some information out to people who maybe were affected by the event last night and haven't sought care yet. Acadiana Area Health Services District is available to serve the community, and that includes anybody who was affected by the trauma, whose family was affected by the event, or just is having difficulty with what happened last night. and they offer outpatient services, crisis intervention, and psychiatric care. And their number is area code 337-262-4100, and they are available 24/7. And they also have a 1-877 number, and it's 1-877-655-8241. I just want to start out by saying that I'm very proud and impressed by how our emergency room performed. At no point did we feel like we were overwhelmed. We are, on a routine basis, a very busy emergency room, and last night was no exception. In fact, in addition to the traumas we had yesterday, we also were sending 4 medical patients to the intensive care unit. The work with our surgical services and all our ancillary staff was phenomenal, and the extra staff that came in was generally very appreciated, and our whole medical community and family as a whole was very supportive and very, very helpful on something that happens that's not at a time where it's not during office hours. I'll answer any questions after Dr. Dinesh Eshte, who is our hospital trauma coordinator.
Thank you, Dr. Cordish. As previously stated, we did receive 5 patients last night. 2 were immediately discharged, and 3 were admitted into the hospital. 2 were admitted under a stable condition. 1 was admitted under a critical condition, which has since been downgraded and will be in stable condition on the floor this afternoon. All of our patients are expected to have a full recovery soon and will soon be discharged from the hospital. I'd like to commend all of our ER physicians, our staff, and our facilities for the treatment and to being ready and prepared to take care of these critically injured patients. I'm very proud personally, and our community should definitely be proud of the trauma program that we started from scratch and that we have built to help better serve this community. And like Dr. Cordish, I'll stand up here and we'll answer any specific questions if you guys have any. Thank you.
Thank you, Dr. Eshte. We'll now take questions.
Did you have the one patient that was critical that went to the hospital? The critical patient was here or at one of the other hospitals?
So we really can only comment on the patients that we treated here. We do know that there were a total of 9 patients at the scene that were transported by EMS. And 3 patients were sent to each of the 3 hospitals in Lafayette, and then we received 2 patients via private vehicle.
Dr. Cordshaw, if you could speak to the number of wounds each of the victims received, and if you may be able to extrapolate the distance from the muzzle to the wound.
Extrapolating distance from muzzle to wound is very poor unless it's very close range. I leave all of that to forensics in the police department in the corners.
Were your victims multiple wounds?
3 of them were.
What kind of head, torso?
Torso and limbs.
No, it was just torso and limbs. I don't know if I can say that.
Were they discussing the incident when they arrived in your ER, sir?
Most of them could not get a clear picture of what happened. Generally, they painted a picture of confusion and panic.
Have they spoken since this morning?
I see patients in the emergency room only. My care ends whenever they leave the emergency room unless something dramatic happens on the floor. Dr. Eshte in the trauma surgical service takes care of the patients once they leave the emergency room.
And your age range on those victims?
40 to, or 30-something to 80-something.
And male, female?
Mix of each. 1 and 4, 3 and 2.
So again, could you characterize the nature of these wounds, trying to understand? Were they all similar?
Most of them were extremity wounds. One patient had a torso wound, and that's the abdomen, and he had torso wound. His wounds were in the torso and the lower extremities. All the other patients had extremity wounds, most prominently the lower extremities.
Like legs?
Yes, sir.
Leg wounds consistent with a handgun?
is consistent with a gun.
One final question for me. I know that all the hospitals in the region go through training for these active shooter type events. Did it just kick in and y'all knew what you were supposed to do? And did you find that all the planning worked well last night when these patients actually came here in coordination with the other hospitals?
The coordination at the other hospitals was actually done at a higher level than me. It was done with Acadian or the paramedics on the scene, and they dispersed the patients. As far as our end, the training, training worked great. I mean, this is what we do. This is why we're becoming a trauma center. It did not tax us in any way. Now, if there was more patients, then we certainly would have started to feel very uncomfortable. And certainly we didn't want a scene like that. But the nurses, the techs, the ancillary staff, the consultants worked very well together. And no patient's care was delayed because of the volume of patients, and no patient who was otherwise in the emergency room was delayed as well.
So in regard to that question, I think the community, the hospital community responded unbelievably to this event. And certainly all that training that we do throughout the year, I think, played out. This is a community that has been certainly, from a disaster standpoint, we have hurricanes and we have other events that have tested the hospital community. And so we responded very well at all three of the facilities. I think the hospital response was equal to the unbelievable response we've seen from the police getting there within a minute, and Acadian there within 6 minutes after the event occurred. And so I can't say enough about the way the hospitals have performed. I also wanted to mention, there's been a lot of examples of heroism that occurred in this event, and we at the hospital recognize folks for making a difference. And actually, one of our employees, Mr. Ronald Thomas, who serves as our facilities and security director at our Lafayette General Surgical Hospital, he and his wife were at the theater actually getting popcorn as the shooting occurred. And Ronald and his wife actually transported one of the victims to the hospital last evening. And so I just want to personally recognize Ronald and his wife for making a difference and doing the right thing in this incident, and it certainly represents what the employees of Lafayette General are all about.
Dr. Cordish, you said that you expect the victims to be released at some point. Is there any idea about how long that'll take, especially the one who was in critical condition?
That's actually a good question.
So the question is, how soon will they recover? Everybody's treatment is different depending on their type of injury. I don't like to give a specific day, but I can tell you in the near future, within days.
Doctor, in terms of mobility, did any of them suffer any serious injuries affecting their mobility?
None.
And the patient that is suspected to be downgraded to stage condition by the CMA, what was the nature of their injuries?
Did I want to say that?
You said it's about stable to good.
No, specific. I think the details specifically for each patient, we'll keep until all the investigation is done. So, in light of keeping privacy for that patient, I'd probably defer that answer.
Doctor, you spoke a little bit about the potential mental health needs of the community. Have you seen that in your hospital, or what would you give to the community that they should watch out for in the future?
I have not been notified of any uptick in patients presenting to our emergency room with mental health concerns. So I can't answer that. And it's certainly an answer is probably yes. I mean, your community can't absorb something like this and just go about their day like nothing happened. As far as what to watch for, basically, if you have any issues, you need to reach out and talk to someone, but especially if it starts affecting your daily activities or you start thinking of thoughts that are harmful or detrimental to yourself or others.
Are
you offering assistance for the family members that are coming to visit their loved ones at your hospital?
Yeah. Yes.
I think on a global perspective, and certainly I think as a country, I think in regard to this mental health issue, I think as we look at what has happened in terms of mental health funding for care throughout the United States, and I'm specifically talking about sort of the reason behind this incident. We have seen dramatic decreases in funding for mental health services throughout the United States, and care has been shifted to an outpatient focus. And I think what we're seeing overall is a real lack of service for patients that are suffering from mental illness. I think we need, as a society, to really look at parity with medical care and psychiatric care in order to hopefully avoid situations like this occurring in the future. If there's no other questions, yes.
Just to wrap things up, I know you guys dealt with a very large volume of people in the ER last night. How was that environment?
The environment of the volume?
Of the ER.
The environment of the ER, I mean, there certainly was a little bit more energy and maybe a little bit of anxiety, but it really was nothing. To say that we dealt with it just like any other day is probably not doing yesterday justice. But the environment of the ER, it did not affect the flow of the ER. It did not affect the patient care. But there definitely was a little bit more, if energy is a good word, or anxiety may not be the best word. But there was a little bit different environment in the emergency room last night.
If there's no other questions, again, I want to thank everyone for coming here for this update. I also want to thank the many nurses and physicians throughout Lafayette General Health System, which is the entire Acadiana region, that phoned last evening, offering their help and assistance and offering to come in if we needed it. And so once again, I want to thank them very much. Thanks again for being here this afternoon.
Thank you.
Great job.
All right, again, that